Welcome to this week's edition of Senior Talks, an exciting new educational program for those age 45 and older in the Harris County area. Senior Talks features various presentations on opiate use, medication management, recovery, and overall health. Senior Talks is sponsored by the Harris County Area Agency on Aging and the Wellderly program through the Council on Recovery. Today, Rossana Ishee will be presenting mental health and addiction. Rossana is the older adult specialist for the Wellderly program, and she is here to share this information with you. Take it away, Rossana.
Thank you. And thank you all for joining us for our today's segment of mental health and addiction. Again, my name is Rossana Ishee. I'm the older adult specialist here at the Wellderly program with the Council on Recovery. So let's get started. We're going to talk a little bit about substance abuse among older adults as far as it being an invisible epidemic. First of all, it's one of the fastest growing health problems facing the country. And there's limited research, data, insufficient knowledge, hurried office visits, all which contribute to substance abuse being overlooked by medical professionals. Shame, stigma, denial, and disapproval are also responsible for the lack of attention to substance abuse in older adults. That's why they call it an invisible epidemic. And so just to share some general facts, social and human services are going to be overwhelmed with an increase in older adults. There's an increased need for age-sensitive substance abuse and mental health prevention and treatment. There's a demand for substance abuse and mental health services, which is likely to increase because of the baby boom. The baby boom cohort tends to use these services more frequently than current older adult cohorts and tend to be less stigmatized by seeking services. Also, 14% of the current U.S. population age 60 and older. There's an expected increase up to 20% by the year 2030. And 61% of the baby boomers are 60 years old and up. Individuals age 85 and older are the fastest growing segment of the population. Also, older adults are the largest consumers of psychoactive medications. For example, 85% of older adults take a prescription medication. 76% use more than one medication daily. And older adults make up 13% of the population and use 1/3 of the prescriptions. Also, 20% use tranquilizers daily. Some of the factors that are associated with prescription drug use in older adults include social isolation, history of a substance use or mental health disorder, and medical exposure to prescription drugs with abuse potential. So, with regards to substance abuse and mental health, chronic use of some drugs can lead to both short and long-term changes in the brain, which can result in mental health issues, including depression, anxiety, aggression, paranoia, hallucinations, and other problems. If an individual has both a substance abuse problem and a mental health issue, for example, depression, anxiety, and bipolar disorder, it is called a co-occurring disorder or a dual diagnosis. Co-occurring disorders also affect each other. Many times, if a mental health problem goes untreated, the substance abuse problem most likely will get worse. Conversely, when alcohol or drug use increases, mental health problems also increase. Co-occurring mental health issues and addiction issues are more common than many people realize. So, roughly 50% of individuals with severe mental disorders are affected by substance abuse. 37% of alcohol abusers and 53% of drug abusers also have at least one serious mental health illness. And of all people diagnosed as mentally ill, 29% abuse either alcohol or drugs. So when we're talking about mental health and well-being, it's just as important in older age as at any other time of life to understand mental health. Anxiety disorders affect 3.8%. Anxiety disorders affect 4% of the older adults. A quarter of deaths from self-harm of older adults 60 and above are related to substance abuse problems, are often overlooked or misdiagnosed. And substance abuse may sharply increase symptoms of mental illness or even trigger new symptoms. Globally, the population is aging rapidly. As we talked about earlier with the population age over 60 years old, it's going to nearly double from 12% to 22%. The most common mental and neurological disorders in older adults right now are depression and dementia. And this affects 5 to 7% of the world's older adults. Everyone has mental health, actually. Most older adults have good mental health, but are at the risk of developing mental disorders, such as neurological disorders or substance use problems. And approximately more than 50% of those seeking addiction treatment services are also coping with mental illness. And many studies have also found that suicidal ideation, suicide attempts, and completed suicide rates are elevated for individuals with an addiction. As far as dual diagnosis among older adults, depression and alcohol use are the most commonly cited co-occurring disorders in older adults. Depression is defined as a prolonged and persistent sadness. And while sadness and grief are normal, temporary losses and hardships of life also, but clinical depression does not go away by itself and lasts for months. Like diabetes or arthritis, depression is a chronic disease. Here's some of the signs and symptoms of depression in older adults. Sadness or feelings of despair, unexplained or aggravated aches and pains, loss of interest in socializing or hobbies, weight loss or loss of appetite, feeling hopeless or helpless, a lack of motivation and energy, and sleep disturbances, which would include either difficulty falling asleep or staying asleep, oversleeping or daytime sleepiness. Loss of self-worth. For example, if an individual worries about being a burden, feelings of worthlessness or self-loathing, slowed movement or speech, increased use of alcohol or other drugs is another symptom of depression. Fixation on death and thoughts of suicide, memory problems, slowed movement and speech, neglecting personal care, skipping meals, forgetting meds, neglecting personal hygiene. These are important signs and symptoms to look out for, either in oneself or in a loved one. Another thing that we want to talk about as far as with depression and anxiety is that 1 in 6 older adults experience elder abuse. And that not only leads to physical injuries, but also to serious, sometimes long-lasting psychological consequences, which include depression and anxiety. Other risk factors for mental problems in older adults includes reduced mobility and chronic pain. For example, if one has reduced mobility, chances are you're not going to be able to be as active as you'd like, which could result in social isolation, and then, of course, leading to feelings of depression, and then chronic pain, Well, just by pain in itself is very uncomfortable, and chances are you're not going to want to go anywhere or talk to anyone. Again, that can also lead to mental health problems by increasing the social isolation and withdrawal. Depression in older adults is definitely a public health problem. It's estimated that 1/4 of today's older adults experience some mental health disorder, which would include dementia. It's estimated that by the year 2030, more than 15 million adults will suffer a mental illness. Understanding mental health is very important. Stigma and judgment exist around serious mental illness. People may expect someone with serious mental illness to look visibly different, and they may tell someone that they don't look ill or that they should just get over it by using willpower. In the US, 1 in 5 adults will experience some form of mental health disorder. 1 in every 22 adults is living with a serious mental illness such as schizophrenia, bipolar disorder, or major depressive episodes. Keep in mind that addiction and mental health disorders are treatable conditions, and they're not someone's fault. And before we wrap up this presentation, I just wanted to emphasize the importance of not harboring any self-stigma. Just keep in mind you're not your illness. You have your own story to tell and a history, a personality. Staying yourself is part of the battle. Be honest about your treatment and choose empowerment over shame. Remember, becoming stronger and more confident is a choice that we all have. Thank you. This concludes our presentation, and you will see on the screen phone numbers that you can call if you need any help or have any questions. And please be sure to stay tuned for our next segment of Senior Talks. Thank you.